Thank you very much. Do we have any questions or comments from Department of Finance or the LAO's office on this matter? All right. Senator Monning, do you have any thoughts or comments?
I just had a quick question on the Song Brown. You mentioned support from the California Endowment. How much is that support, and how does that translate? How many positions would that support? Do you know?
Well, the total amount, it's a 3-year grant of $52 million. The interest of the endowment is, we're working as hard as we can to get that money out as quickly as we can in order to have immediate impact in underserved communities. And underserved communities can be, rural, can be inner city. A lot of our grantees and loan repayment awardees, they're all in primary care, and many of them work in community clinics.
Yeah, I'm familiar with the program. We have a number of recipients in the district I represent that has low-income rural areas. My question is, how many positions would this grant fund in terms of loan repayments? How many primary care doctors can we get into rural, underserved areas during the course of this program?
Okay. It's doctors, it's nurse practitioners, and it's physician's assistants and others. I'm going to defer to my colleague who will have that information.
Thank you, Director David, and Madam Chair, Senator. Thank you for the opportunity to comment on your question. With respect to the $52 million grant from the California Endowment, it's split into 2 different investments. One is Song Brown, as you mentioned, and the other one is the Health Professions Education Foundation. $21 million is directed towards Song Brown, $31 million is directed towards the Health Professions Education Foundation. We can provide you with specific information. We don't have that information available. For the Song Brown component, it is $21 million over the course of 3 years, so it's $7 million. It's generally $7 million per year. And those are specifically to provide funding for residency training programs. So it's an investment in the residency training slots with the purpose that those programs that receive funding from Song Brown then would, in essence, provide clinical rotations in underserved areas. And that's because we know that residents that are exposed to underserved areas are more likely to practice in underserved areas. With respect to your other question regarding the foundation and scholarships and loan repayments, it's $31 million over the course of 3 years. It's the first year, it's a 3-year grant. The first year it is $14 million, the second year is $9 million, and the third year is $8 million. And depending on the demand, we continue to communicate with the endowment with respect to how to prioritize the existing professions, but they are in 3 core areas. The first one is physicians, physicians that are required to practice in underserved areas. The second one is in advanced practice clinicians like your physician assistants and your nurse practitioners. And the third focus is around allied health, frontline workers, and specifically community health workers and promotores. So the numbers in terms of the impact varies depending on the dollars that are invested per year, and it also varies depending on the dollars that are invested in the specific programs. But we can follow up and provide you the specific information.
Great, I appreciate that. And again, as we try to implement the Affordable Care Act, our ability to be successful, this program is critical to expanding frontline primary care providers. So I appreciate your attention to that. Thank you.
Thank you. I'm just going to ask if there's any public comment on this portion of the presentation. Welcome.
Thank you, Madam Chair. Eduardo Martinez on behalf of the California Medical Association. First, want to acknowledge and thank very much the administration for this proposal. As Senator Monning said, very important steps that the state needs to take to make sure we get residents and physicians trained in underserved areas. We've been in conversations with Song Brown and OSHPD about some of the specifics of the proposal, and we appreciate the committee holding this item open. We're going to continue those dialogues and hopefully make some constructive suggestions in continuance with what the governor has proposed. Thank you.
Thank you very much. And we'll be hearing a little bit more about the program a little later in the presentation. So thank you very much for those comments.
Thank you. I'm Jody Hicks, representing the California Academy of Family Physicians, also in strong support, and want to thank the governor and OSHPD for looking at this residency program issue, which is a priority for the family physicians. And just want to say a couple of things. We do believe that this is important, and what they're doing in trying to get more primary care doctors is vital. We do think it's going to take a lot of funding to get what we need in California and make sure that that funding is going to new residency slots so we can it fixes it both short term. They're treating some 600 patients a year immediately, and then long term, and as Oshped know, California has a really good retention rate. It's about a 70% chance that they'll stay and practice in California. So thank you.
Thank you very much for your support of that very important program. All right, so the overview has been completed, so we're going to move on to the next subject, peer personnel support, investment in Mental Health Wellness Act of 2013. And before you begin, pardon me, we, the members of the committee, have a press conference. We are both members of the Ethics Working Group, and there is a press conference at 11 o'clock. We will break just before 11 for a very brief recess and then come right back. So I just wanted to let you know that in advance. Thank you very much. Please proceed.
Absolutely. Thank you, Madam Chair, Senator, and I will attempt to speak fast. I can also do it in Spanish, and it's faster.
Okay, let's start in Spanish. That would be great.
Agenda item number 2, again, Lupe Alonso Diaz, Deputy Director for Healthcare Workforce. As you know, as part of the fiscal year 13-14 budget, OSHPD received a $2 million appropriation specific to providing training in the areas of crisis management, suicide prevention, recovery planning, as well as targeted case management. The purpose of the $2 million appropriation was also to facilitate employment for peer specialists. To develop that RFP, OSHPD engaged a number of different stakeholders via a focus group. That focus group was participated by about 20 individuals. We also released a survey. That survey received about 163 responses. As a result of the feedback that we received from the survey as well as the focus group, we developed that RFP. That RFP was released December 27th. As a result of releasing that RFP, we did also conduct 2 mandatory bidders conference calls for an opportunity to hear directly from those organizations that are interested in participating. As a result of that, we expect to fund at least 4 contracts expecting to be about $500,000 each. The deadline is tomorrow, so we don't have an update specifically in terms of the number of organizations that will apply. As of last night, 1 organization had applied, but we know that typically most proposals come in the day of the deadline. The purpose of the RFP is to focus in 4 very distinct areas that are very complementary and support the Mental Health Wellness Act as well as the new 5-year plan for workforce education and training. The 4 components of the RFP include developing career pathways for peer support specialists in order to facilitate employment in the community public mental health system. The second component of the RFP is to, in addition to defining it, is to increase the number of individuals that are participating in those pathways. The third component of that RFP is to expand as well as to establish and build training programs specific to peer support specialists. And finally, the last core component of that RFP is to facilitate the employment of peer specialists in the community public mental health system. As I mentioned, the deadline is tomorrow, and OSHPD is developing a group of stakeholders that will help support and advise the department as we look at the competitiveness of the applications that we receive.
Thank you very much. Do you have any questions? Any comments by Department of Finance or LAO? All right. Any public comment on this matter? Public comment? Thank you all very much. Obviously, this is an extremely important program. We wish you much luck. Sounds like it's very well planned out, and we'll be looking forward to the information received and hearing more about the applications and the success of the program. Any questions from you, Senator Monning, on this matter? All right. And this is an information item as well, so thank you very much for that presentation. The next item is the Healthcare Reform Health Network, and may I just ask, do you know how long this presentation may be? I'm not trying to rush you. I'm just trying to figure out whether we should break now or try to. Why don't we proceed?
I can do it in a minute.
We'll go for it.
OSHPD requests an increase in expenditure authority from the California Health Data and Planning Fund of $355,000 annually starting in fiscal year 14-15 and ongoing. The purpose of this request is to make permanent 4 limited-term positions, 3 limited-term in the proactive health professional shortage area designations, otherwise known as HPSAs, and the 4th position is a limited-term position to continue implementing the department's healthcare reform efforts. As you know, the department is the primary care office. We work directly with HRSA in order to administer and develop federal designations considered HPSAs. HPSAs are an important contribution in terms of supporting the Affordable Care Act. Most of the grants that are required through the ACA do require some component of the grant applicant to be designated in a HPSA in a health professional shortage area, so this supports that effort. Via our proactive process, we have, as a result, have designated 24 HPSAs. That includes about 2.3 million Californians in those areas. The last component, the 4th position, is again to support the department's efforts with respect to healthcare reform implementation.
All right, thank you very much. Any additional comments? Department of Finance or LAO, any comments? All right. Is there any public comment on this matter? Senator Mani? All right, looks like this is very well supported. No opposition. Would you like to make a motion, Senator Mani? Thank you very much. Senator Mani moves. I am in agreement. We will adopt that. Thank you very much. All right. Why don't we go on to the next one? Item 4, hospital inpatient discharge data audit. Moving right along.
Good morning,
Good morning.
Chairwoman Corbett and members. Again, I'm Ron Spingarn, Deputy Director of the Healthcare Information Division at OSHPD. This proposal requests authority to spend $652,000 in the 2014-15 fiscal year and ongoing $636,000 from the California Health Data and Planning Fund to perform required periodic audits of our hospital inpatient data used to produce our healthcare outcome reports. The funds would be used to create 2 full-time permanent positions. One would identify potential data quality issues through what we call data mining, and the other one would do outreach to hospitals to provide or coordinate technical assistance to hospitals to improve their data quality. It would also authorize up to $400,000 in contracting authority to perform on-site medical record abstractions at the hospitals to audit around 4,000 medical charts per year. It will strengthen our ability to ensure our hospital patient data are accurate. The data are used not just by OSHPD, but by Health and Human Services Department, Public Health Department, local public health departments, and external researchers and other entities. A little bit of background on this program. For around 30 years, we've collected hospital inpatient data on all state licensed hospitals, and since 2005, emergency department data as well as outpatient records from state licensed hospitals. So this proposal relates to those 3 programs, and the 3 reasons we're asking for this now are because the data use has increased over the years. Our outcome reports, the number of them have increased over the years, in part because of healthcare reform and also just a general increase in transparency. Also, on October 1st, 2014, the federal government is requiring a change in its hospital coding systems and patient records. It's called ICD-10. ICD-9 is being used now, and the number and complexity of the codes is going to be increasing significantly. And thank you for your consideration, and happy to answer any questions.
Thank you very much. I note as part of this proposal that a vendor would conduct the audits, and I'm just wondering, this is maybe sort of a specific question, but in the contract, I was just wondering what sort of, I see what sort of data that you're collecting, but I'm just interested in how that data is, the ease of the manipulation of that data for users who may be using this information, if that's how that's taken into consideration in the putting the contract together.
So the auditing, the contract for the auditing is actually to make sure that the records in the hospitals reflect the data that's being reported to OSHPD by the hospitals.
Okay.
So we're verifying that it's actually accurate.
Okay.
The use of the data is a separate process.
Okay.
It doesn't apply to the contract.
So this is just tracking the data collection to
Right.
make sure it's accurate. Okay. All right. Thank you very much. Any additional questions about this presentation? Any comment by Department of Finance or LAO? All right. Public comment on this matter. Good morning.
Good morning. Beth Capel for Health Access California. We're pleased to be here in support of this measure. For several decades, we've complained that OSHPD failed to audit this data in the field, and we're pleased they're starting to do it. This is cutting-edge stuff in terms of reducing healthcare costs while improving quality. So we commend the office for moving ahead on this.
Thank you very much. Any other public comment? Any comments, Senator Monning? All right, this item is moved by Senator Monning, and I agree as well, so that is adopted. Thank you very much. And I think we will take just a quick pause. The next item that we will take up when we return will be the Song Brown Primary Care Residency item, and we will just be back in about 15 minutes. So thank you very much. We're in recess, and we will return shortly. Thank you very much for your understanding. Brown Primary Care Residency Act. Welcome back to the presenters.
Thank you, Madam Chair. OSHPD requests $2.84 million per year for 3 years in California Health Data and Planning Fund Expenditure Authority. The purpose would be to expand the Song Brown program to fund other primary care residencies, as well as to expand eligibility of the program to include teaching health centers. This proposal also establishes a 3-year limited term position and $106,000 in Data Planning Fund Expenditure Authority to develop and implement the program. With respect to the first component of the proposal, expanding eligibility to other primary care specialties, as you may know, Song Brown provides grants to residency training programs. They specifically include family medicine physician residents, family nurse practitioners, FNPs, primary care physician assistants, PAs, and registered nurses, RNs. The residents and trainees that are supported by the Song Brown funded residency programs are required to have clinical rotations in underserved areas. This specific proposal would expand eligibility to other primary care specialties beyond family medicine to include internal medicine, obstetrics and gynecology, OBGYN, as well as pediatrics. The $2.84 million would result in 25 grants to internal medicine, OBGYN, and PEDS residency programs, training a total of 159 primary care residents. The funding would be divided 50% to internal medicine, and the remaining 50% would be divided equally between OBGYN and pediatric residency training programs. This proposal would not affect the existing funding for the Song Brown program. The second component of this proposal would expand eligibility to teaching health centers. Currently, only medical school-based residency programs are eligible to apply for Song Brown. The data documents that residents that are trained in underserved areas, and particularly in community clinic settings, are 3 times more likely to practice in underserved areas.
Thank you very much for that great presentation. And this is an item that we will probably be holding open, but I just want to say I'm very pleased to see the discussion about the expansion. I think it's very important, makes sense for our communities we're wishing to serve. Thank you. Does the Department of Finance or LAO have any comments on this one?
Thank you, Madam Chair. Felix Zhu with the Legislative Analyst's Office. We have no issues with the proposal per se. However, as noted in the staff agenda, this proposal requires, in addition to expenditure authority, statutory changes, and we think there needs to be more clarity as to whether these changes will be pursued through policy or budget. Thank you.
Yes, thank you very much. Very good point, and we will be answering that question as we move along. Thank you. Any other comments? All right. Senator Monning, would you like to say anything? Any public comment on this item? I know we've already had a little bit of public comment on this item, so perhaps not. All right. This is an item that we will be holding open. Thank you very much for your presentation on this item. The next item will be Mental Health Services Act and the Unspent Workforce Education Training Funds. Welcome again.
Thank you. Thank you, Madam Chair, Senator. OSHPD requests $102,000 in unexpended MHSA Mental Health Services Act WET Workforce Education and Training funds be appropriated through fiscal year 17-18 for mental health WET program purposes. The fiscal year 12-13 budget transferred the WET programs from the former Department of Mental Health to OSHPD. The fiscal year 13-14 budget included a reappropriation of $7.8 million in unexpended WET funds through fiscal year 17-18. Of that $7.8 million, there was $1.7 million in unexpended WET contract funds. Since this unspent balance was not part of the OSHPD appropriation, OSHPD requested a new appropriation in fiscal year 13-14 via a May revised budget request. As a result of year-end closing exercises, after the May revised budget request had been submitted to the legislature, OSHPD received new information regarding 2 specific contracts and the unexpended balances. As such, the unexpended balances from those 2 specific contracts could not be included in the May revised 13 proposal. As a result, this request captures those unexpended balances.
All right, thank you. Any comment by Department of Finance or Elio? Okay, thank you very much. Is there any public comment on this matter? All right, Senator Mani?
No question. We need a motion.
Yes, we do. Motion's in order. Senator Mani moves this item, and I agree. That is adopted. Thank you very much. And our next subject matter is the Office of Systems Integration, CHHSA. Oh, thank you very much. I'm sorry, we're changing panels. Thank you very much for the presentation. Appreciate your work. All right. Good morning, everyone. Let's welcome the new panel. Please introduce yourselves.
Good morning, Madam Chair and members. My name is John Wardlaw. I'm an Assistant Secretary with the Health and Human Services Agency. Thank you for your time this morning on this important proposal. This proposal is it's very important to the agency. It is really for the purposes of our planning for information technology systems of the future. It really at the heart of it is how is the Health and Human Services going to be providing services to the public in the future. Just for context purposes, many of our departments' technology infrastructure was built 20, 25, 30 years ago. And at that time, as an analogy, our telephones, for example, cell phone technology has advanced hugely. In today's environment, the telephone is your computer, it's your telephone, it's your internet access, it's kind of the lifeblood of how folks interact today. That technology has advanced significantly in the last 20 years or so. Our systems are still very, very dated. And in the technology world, you'll see that today's infrastructure allows for what we call interoperable systems, meaning that you build a system and it's able to communicate with the various systems throughout the state. Okay? If planned properly. And if we don't do the adequate planning on this, we can spend duplicative dollars in environments. Back when the systems that we have now were built, they are built in what's called stovepipe environments, meaning they were pretty much single program focused. So child welfare, for example, has a system designed specifically for that program, not the other programs in the state. We're now getting to a point where we need to replace these systems, and we need to thoughtfully plan how we approach this. So we are asking for 3 positions and reimbursement authority for the purpose of doing this important planning. Reimbursement authority is not an actual request for new general fund dollars. It would be tapping into the resources that the departments currently have. I have joined with me is Gretchen Hernandez. She is our agency information officer, and she will walk us through the top priorities of her office.
Thank you very much. Welcome.
Good morning, Madam Chair and members. I appreciate the opportunity to speak with you this morning. As the AIO, I'll just speak very briefly about the priorities of the proposal. We have it categorized in 3 specific areas: enterprise architecture, governance, and project assessment. Enterprise architecture will address primarily the IT strategic plan for the agency that's setting the roadmap. As John described, the systems that are in place today we're very challenged in meeting the needs of the constituents. As fast-paced as technology is moving, those stovepipe solutions are not meeting the needs. So we need to set a roadmap for the agency and how we drive towards getting there with technology. The formalized governance will be looking primarily at prioritizing the initiatives, ensuring that the highest programmatic needs are being addressed, and then looking for collaboration opportunities. So instead of having separate departments and offices come forward with individual requests, how can we partner together to meet similar business needs? The other area is project assessment. So we'll be looking at best practices for project management and system development, and then also preliminary assessment before FSRs are approved, projects are formally approved, to ensure that the schedule and the cost are in alignment. And these initiatives are focused on ensuring that we have achieved project success before we've started. So those are the 3 key areas. They're primarily aligned. We've had the activities occurring within the office currently. When statute was put into place, government code, which identified the roles and responsibilities of the AIO, we took a creative approach with some redirected temporary resources. The challenges have been that we have not been able to ensure the continuity in the programs, so we're asking for the permanent resources to ensure that we have that continuity in place.
Thank you very much.
Madam Chair, there
Yes.
is another part of this proposal. The first piece dealt with the positions for the Office of the Agency Information Officer. The second component deals with a completely separate office called the Office of Systems Integration. They are within the Health and Human Services Agency, the entity that has been lead on project management for some of our most complex, large projects within the agency. What we're asking for is provisional language that would allow for OSI to be called in by other departments that may be struggling with projects to quickly engage with that particular department to address any problems that they're having in their deployment of their new information technology systems. The maturity level within the agency varies by department. Some departments are very skilled at implementing projects. Others, however, quite frankly, struggle. And so to the extent that we're seeing warning signs or problems, we want to be able to get our folks that are really totally about implementing projects engaged when necessary. So this provisional language would allow for OSI, through reimbursements, to charge those departments that are calling for help on a very quick basis. There is a legislative reporting component that if it were to exceed $200,000, we would report to the legislature, but we would act very quickly. And so, happy to answer any questions on that.
Thank you very much. Senator Ronning, did you have a quick question before we call on DOF? Yes. Yes, I thought you were. I saw your earnest look in your. I have an earnest look myself. Department of Finance, any concerns, questions on this item? LEO, please. Yes.
Lourdes Morales with the Legislative Analyst Office. Good morning, Madam Chair. The Office of the Agency Information Officer does have limited capacity in its current form to provide this type of IT strategic planning, and we do believe that collectively the proposed strategic plan would enhance the agency's ability to support projects, provide oversight, and advisory services to departments so that projects could be more successfully deployed. However, we do note that the proposal does request modest resources for a rather ambitious policy objective. It is the first time the OAIO would be allocated dedicated resources for this purpose, and so we question that there is uncertainty regarding the appropriate level of staff for this work. With the respect to OSI's ability to provide technical assistance to departments that need, the technical mechanism to achieve that goal is an exemption from Section 28.5 of the Annual Budget Act. After discussing this issue with the administration, we find that the development of this request, as well as the review, which includes review from the Department of Finance, takes 90 days or more. Since Section 28.5 provides for a waiver of what is at most a 30-day legislative review process, we find that an exemption from Section 28.5 does not address the root cause of the delay. Rather, it appears it's the administration's own internal review process that's impeding OSI from providing technical assistance to departments. Therefore, we do agree that IT strategic planning would enhance the department's ability to support IT projects and therefore support the crux of the governor's proposal. However, given the uncertainty regarding the necessary resources, we suggest approving the resources on a 3-year limited term basis, followed by a status report from the agency on the extent to which the allocated resources support the objectives of the proposal. With respect to the provisional language, we do not recommend approval as it does not support the stated objective to provide more timely assistance. Thank you.
Thank you very much.
Madam Chair, if I may, relative to, and we thank the thoughtful analysis on behalf of the LAO, the limited term recommendation on those positions, we do have concerns in that it's difficult to recruit folks for limited term positions. They tend to come in, and then very quickly move on to permanent spots within the administration. So to the extent, and I don't think there's any disagreement about the importance of this function, we do view it as a permanent function, and for stability purposes, we'd like to get a permanent position.
All right, fair enough. Thank you. Department of Finance?
Hong Law, Department of Finance. These requests are actually fairly new for the Office of System Integration, and typically our review process, once we receive the budget revision request, it takes about 1 to 2 weeks for our review and processing, and also drafting up a notification to the legislature, in which case there is a 30-day wait period for any approval necessary.